I'm very excited to bring up the person who has done so much to get these kind of turnouts going. A person who's educated me on how the American healthcare system has more perverse incentives than the ads on an Incel's Pornhub account. A person who can lucidly explain how Medicare will be the pile driver we need to apply to the capitalist class in order to get the socialized medicine that we deserve. A man who's a person who's a single-payer health justice advocate with the Democratic Socialists of America. Get up for DSA. Over the past year, he's driven tens of thousands of miles to speak to DSA locals, at law schools, med schools, churches, Culvers, in 37 states. With his partner, he hosts Heavy Medical, a podcast about health policy and metal music. Very worthwhile checking out. I've turned on a lot of my family members and friends to that. His book, Health Justice Now, Single Payer and What Comes Next, will be published by Melville House in 2019, if it is done in time. Guys, please give a very warm welcome to Timothy Faust.
Yeah, shit, yeah. You ready? It's like, what, 9:30 on a Friday night? I don't know what day it is. This is fantastic. Thank you for being here. We're going to get real serious and real sad and then real amped at the same time. Prepare yourselves. I want to say thank you to Arish and to Luke and to Byron, but I want to say thank you especially to Susan. I'm going to embarrass her for a little bit, but Adapt has saved the lives of tens of thousands of people in the U.S. And I think many folks here understand that Adapt is the front line. They are the freedom fighters for people with disabilities, people who don't yet know that they are temporarily able-bodied. We all saw what happened in the Capitol last year when the gutting of Medicaid was on the table, but it's more than just that. I want to talk really briefly, kind of not in my notes, about what happened in Tennessee in the 2000s. In Tennessee in the 2000s, there was a question of, do people with disabilities deserve home health? Do they deserve long-term care, the kinds of things that aren't right now in the Sanders bill? And here were the stakes. All across the state of Tennessee, which is not a very nice place to be a person with disabilities, couples had to divorce so that they would lose enough money to qualify for home health. People would leave their families and travel to Colorado, leave everything they had behind in the hopes that there they could get the home health Medicaid that they deserved. People were being forced into the streets. You had protests day and night in the Tennessee Capitol, and Adapt won. Because people were literally dying. There were staged suicides in the Capitol steps of couples that did not want a divorce to receive home health. People's bodies are on the line. People's bodies have always been on the line, and Adapt is always there first, fighting the fight that needs to be fought. So thank you very much, Susan. The bill that we need has not yet been written. I was on the Amtrak today, carrying some illicit bratwurst from Milwaukee to Chicago. Hell yeah, well, it's Usingers, it's fantastic. And I was thinking about last time I was here. I was here about a year ago talking to DSA. Maybe some of y'all were there, it was fantastic. And one of the things I heard in Chicago, was one of my first times going on the road, was that Cook County Prison Systems is the largest provider of mental health anywhere in the state of Illinois. And I've been to 37 states since, and I've heard that same thing 37 times, because it turns out in Texas, it is the Harris County prison systems that are the largest provider of mental health services in the state. In Pennsylvania, it's the Philadelphia County, I forget what county that is, prison service state. In New York, it is Rikers Island. That is the largest mental health facility in all of New York State. Wisconsin, Milwaukee County. And so I got to thinking of that, right? Because this is a truism. We all know it. We all say it a lot, and we say it because it's true, which is fantastic. But that doesn't really understand or really get to what it means for to have a prison be outsourced as our mental health provider. So I'm going to tell you a little anecdote. It's not mine. It's about that of a guy named Franklin Bynum, who's in Harris County, Houston, DSA. He's an abolitionist running for judge there. Franklin is a public defender. And he treats patients, or he treats clients that have mental health problems. And here's what this looks like to have your jail be the largest mental health facility. Every morning, Franklin wakes up and a computer tells him 4 names. And so he goes to the Harris County Courthouse, and the Harris County Courthouse is a beautiful building, really, really gorgeous. And each of these big, ornate courtrooms has a fake wall. And behind that fake wall is basically a dungeon cell. And in that dungeon cell is one of the people that Franklin has to speak to. They've been kept there for 2, 3, 4, maybe even 5 days. And Franklin walks in and Franklin says, my name is Franklin Bynum and I'm your public defender. Realistically, I think you better plead guilty so you can get out of here in time. Because if these people don't plead guilty for things like trespassing or other misdemeanors, they're going to be held $10,000 cash bail that they can't afford. And these people have medicine that they need. They need their meds every single day. They've already been kept a couple of days without those meds and they're not in good shape. And so the best thing a public defender can do is get a person to plead guilty so they can get out and get the meds they need. But if a person can't do that, if a person looks at Franklin and says, I'm the king of Harris County and I'm going to fire you when I get back home because they're having a hard time, then that person gets held for 30 days. The person gets held for 30 days until Harris County can find a psychologist to bring toward them. And that care isn't great. All of a sudden, they're put into a mental health ward inside the jail, or they're put into a jail ward inside the hospital. Here's how it shakes out, right? It's technically not a crime in the U.S. to be poor. It's technically not a crime in the U.S. to be sick. And it's technically not a crime to be black or brown, but once you fall into the intersections, the rules begin to change for you, right? If you're a poor single mother, if you're a poor single mother of color, for example, you have virtually no right to privacy anywhere in the U.S. If you're in Section 8 housing, every single month, a state agent comes to your house and counts the shoes in your shoe rack. And if there are too many shoes there, or if there's a man's shoes, all of a sudden you lose eligibility for Section 8 housing. If you're a person who's in a wheelchair and you're on Medicaid, every single month a nurse has to come to your house to see if you're still disabled, if you still need that wheelchair, or if you're faking it. Right, there's this concept, this idea of the prison to hospital pipeline, but it's not a pipeline, it's like a pinball machine, right? It's a giant invisible flippers that bounce you around from jail to hospital, to jail to hospital, to jail to hospital, until fundamentally at some point there's no difference between the two. And so, because we refuse to care for people once they become sick, and because we make them sick, and if you're the wrong kind of sick or you're the wrong kind of person, we just delegate your care to the prison system. And now we just delegate that to the private sector. But fortunately, the Democrats and the liberals, and this is not my speech yet, this is an early thing. The Democrats and the liberals know that this is a problem, and they've got a plan to change it, right? In Houston, we've got a big nonprofit called the Arnold Foundation. There's a benevolent billionaire, Laura Arnold, James Arnold, I don't give a fuck, who really wants to understand what's driving all this recidivism. Why are folks bouncing back and forth between jail and hospital, or jail and jail? And so I actually volunteered in a project for them like 4 or 5 years ago. I didn't know what they were up to. And they wanted to understand the question of what predicts recidivism. Right? Why do people go back to jail over and over again? So they wanted to understand these things, and so they took 3 brilliant data scientists, and they also took me, and we sat into a little like Mission Impossible style white room with a virtual machine, and we poured over prison data sets, we poured over cop data sets, we poured over courthouse data sets, and after months and months of regressions, and random forest models, and complicated computer horseshit, we discovered this very complex scientific analytical truth, that people who go to jail most often and who go back to jail after they're in jail already are arrested for the crime of being homeless. Right? That's the fucking thing we figured out. We discovered that people who are homeless go to jail, get out of jail, remain homeless, get arrested, go back and forth, back and forth, back and forth. And this is a revelation to these wealthy Democrats and wealthy liberals. But luckily, they took this, they've got billions of dollars, they got more money than Christ. They take this project and they build it into a little black box for judges, right? And this little black box helps judges understand who to sentence and for how long based upon characteristics of folks that have been sentenced in the past. And as you can probably predict, that means that it's poor people and people of color and sick people who are just getting sentenced in the exact same way they were before the black box, except this time, a computer tells the judge that they're doing the right thing. This is the neoliberal approach to the carceral state. And you cannot separate health inequity in America from the carceral state. The neoliberal approach is not to dismantle it, but to rationalize it. To invent processes which reenact already existing acts of structural violence, the dehumanization of poor people, of sick people, and of people of color, which then cite those old acts as justification for the new acts. It is a tautological model of immiseration. And so before I begin, I want to be explicit, right? Healthcare is not enough. Insurance is not enough. Our goal is not healthcare, but emancipation. Yeah. We must put the people, that's goddamn right. It is emancipation. We must put the people who have been harmed most at the front of the line and walk together every goddamn step of the way, and we must never compromise until all people have been liberated. Now it's time for my single-payer speech. My name is Timothy Faust, member of DSA, driving around all the time. It kicks ass. I got a 2002 Honda CR-V, 310,000 miles now, fantastic. I've been driving around the US talking to folks about healthcare and health inequity, right? I think after this I'll stick around for a while. I would love to do Q&A. I will A any Qs anybody has, but I hope y'all pay it back, because I want y'all to A my Qs, right? I'll say this in a minute, but I really want and I really need to understand. I have to understand health injustice and health inequity from the ground up. And so your stories and anecdotes and testimonials are real important to me. Also, time for a disclosure. I am currently employed, ironically enough, within the insurance industry. Obviously, as you can tell, the things I say don't reflect them or vice versa. This is just my atonement for participating in capitalism. And if that bothers you, fantastic, it bothers me too. I just can't quit the job because I need the insurance. I wish I were fucking kidding, man. I pay $2,000 a month for healthcare. I said earlier, right, that I want your stories, right, that I want to understand healthcare from the ground up, because health care is local. Health disparity is local. There's a world of difference between health needs in North Brooklyn and South Brooklyn, Boston and Birmingham, or Los Angeles and Little Rock, or Escanaba, Eau Claire, East Milwaukee. And so I wanted to understand more, right? I wanted to know, not with my eyes and with my heart, not just from papers and books, which are for nerds, how healthcare needs manifest. But throughout it all, I've just seen so much suffering. Right? I've been welcomed into families thrust into inescapable debt because of complications from pregnancy. And hell, I've met the children whose birth caused that debt, right? Who were born into this debt. It is their birthright, and they will carry it their entire life. And I've sat with widows and widowers, people who watched those whom they love suffer and whom out of love spent everything they had in an attempt to ameliorate that agony, and who failed, or who were failed, and who now carry themselves in both heartbreak and poverty. I've met folks who were just born into bodies which suffer, right? And I've wept with them as they share with me the depth of the dehumanization forced upon them, whose daily existence is a constant and blaring reminder that they are not wanted, and who are forced to make an occupation of begging over and over again for basic help. And I visited the wealthy hospital campuses, right, for the wealthy hospital patients. I visited these virtual islands in the middle of their cities. And I visited the neighborhoods surrounding these hospitals, right? Black neighborhoods and brown neighborhoods, systematically drained of capital and drained of labor in a dance reminiscent of colonialism, who, too poor for the hospital, I mean, hell, in fact, made poor by the hospital, suffer and die much, much, much sooner than people in wealthier neighborhoods, even 2 or 3 miles away. And over time, like many of y'all, I've felt my own body betray me. Right? I've looked myself in the mirror and I've seen my own coming crisis. I've paced miles and miles around my own city block, fearing the decay of my own temporary able-bodiedness and the wave of punishments. Punishments for the sin of being sick, in which I'm going to drown. But it does not do justice to the folks I've met to simply pornographize their suffering, right? That's not enough. It is insufficient to simply recite a litany of human pain. And so I'm here to honor those who have shared their suffering with me in the long, long hope that we all together can build that better world in which nobody needs suffer as they have. Here are the contours of the world American health finance has given us. 1, America spends more than any other country in the world on healthcare. Almost twice as much per capita as the next highest spender. But America does not care about community health. America does not care about population health. America does not care about that which cannot be packaged and sold. 2, 75% of our spending goes to treat chronic conditions that are entirely preventable. But nobody footing the bill has tried to prevent them in the first place. And 3, our system of for-profit private insurers literally takes money from poor people and gives it to the wealthy. It is negatively redistributive. In 2014, it pushed 20 million people into poverty, or from poverty into extreme poverty. Now, I can't give you a quick fix, right? There is no technical magic by which we destroy this hateful machine. But I can, I hope, offer you a vision, right? An aspiration, an understanding of the tools by which we together build that better world. So if you permit me, I want to talk about 3 things. What we have, what we want, and what comes next. I want to talk about the overwhelming and numbing brutality of for-profit healthcare. I want to talk about the relatively benign structural changes that we demand instead, and then I want to talk about something bigger, and frankly, something more important. I want to talk about that broader vision of the better world, the moral compulsion of health justice. Y'all on board? Yeah. Are there still kids here? No. Wonderful. So this is T-Bone After Dark. I want to start off by confirming something everybody here already knows, right? Everybody here feels deep, deep down in their bones, which is that you are being fucked over. Yeah. You are being made to suffer. You are being exploited for profit. Because fundamentally, we have created a world in which you are made sick and then punished for being sick so that somebody else can bring home the millions. Let's talk about why, right? By and large, the costs of receiving health care are much, much more than any individual person can afford by themselves, right? But not a lot of folks need health care in a given year. In a given year, 50% of all health care spending comes from 5% of the population. 80% of all health care spending comes from 20% of the population. This is a fungible population, right? It bounces around. Maybe some years you get hit by a car, or you have trauma, or you give birth to a child, and other years you don't. So costs move around, but when they hit you pretty hard. And if we made everybody pay for all their own health care costs out of pocket, eventually millions upon millions would go into crushing debt and medical bankruptcy. I mean, that's not a guess, that's history, because out-of-pocket spending used to be the only way we paid for health care. And it wasn't until a bunch of nurses and a bunch of unionists, and yes, a bunch of socialists, insisted that letting folks go into poverty because of illness was immoral, that we shifted to a new payer model, and that's the idea of insurance. Now, insurers are organizations, or in the US, companies, that receive revenue by charging you monthly premiums. When somebody gets sick, insurers spend the money they take from everybody to pay off a portion of somebody's healthcare costs, plus keep a profit for themselves. So the more revenue an insurer receives from customers, or realistically, the more subsidy it receives from public money, the wider those costs are spread and the lower the insurer's per person costs. This idea is called the risk pool. But here's the real dumb thing, right? Because if people use their insurance plans, the insurer loses money. So if an insurer has too many people who use their insurance plans, or too many expensive people, or too few healthy people, if, for example, they get just one unexpected person with hemophilia whose care can cost up to $1 million a year, well, then its per person costs really go up. And so to compensate, it increases premiums. But when premiums go up, people who can't afford them drop out. Unless, of course, they're sick and they can't afford not to afford those premiums. They stay on board, so per person costs keep going up. So premiums also keep going up. It builds this huge, stupid, vicious cycle, this big Ouroboros of misery. So what an insurer wants is as large and as healthy a risk pool as possible. Or it wants to find ways to kick out sick customers or coerce them into leaving. Maybe it drops coverage for drugs that sick people need. Maybe it cuts off access to the doctors who treat the sickest patients. Because it turns out that because insurance companies lose money when you get sick, the task of an insurance company is to make sick people, as much as it can, somebody else's problem. Right? We've been tricked into viewing healthcare as a transaction instead of a relationship between a person, their body, their neighborhood, and their doctors. That's perverted, right? We've just mistaken the profit motives of corporations for healthcare. And over time, we've delegated the responsibility for providing insurance to employers, but that's hosed too, because that results in a status quo of total employer domination, which are access to things like contraception, or hormone therapy, or blood transfusions are determined by the whims of your employer. But if you aren't lucky enough to have an employer, or if you've got an employer and your employer's an asshole, you're just left behind, right? Because the people who profit from the commodification of our bodies have decided it is acceptable to shackle the well-being of children to whether or not their parents were lucky enough to have gone back in time 40 years, learned to code, and found a so-called benevolent employer. Welcome to the hell world of America 2018. I mean, no, don't ooh, yeah, it gets worse. I mean, hell, it's too early to talk for things not to get worse, right? Because the costs of healthcare keep increasing. Oh, and they increase much, much faster than inflation. Part of that's because more people are living longer with chronic conditions, right? So we spend more money taking care of people longer. Things like heart attacks or diabetes aren't the death sentences they were 2 or 3 generations ago. But that's not the real problem. That's never the real problem, right? Most of these cost increases occur because hospital CEOs and equipment manufacturers and pharmaceutical companies, close personal friend Martin Shkreli, keep finding more and more. He's fantastic, isn't he? What a fucking weasel-faced piece of shit. They found ways to charge more money for the same services or rack up fees for unnecessary services, and no private insurer can stop it. Here's how that shakes out in the US, right? In the US, the average inpatient procedure costs 40% more than the same procedure when performed on the same patient when performed in France. Or you got MRIs. You'll know what MRIs are, right? MRIs are just big fancy tubes that print money. And in the US, an MRI scan costs 5 times more than the same machine doing the same scan when it's done in Australia. The costs are high because the prices are high. Or most egregiously, consider the relationship between primary care and hospitals, right? Primary care is the things like basic medications, family checkups, the kinds of things you get from your GP or family doctor. It's high volume, it's low margin, and generally it's not super profitable. Now, but conversely, a hospital gets paid an average of $2,000 a night for an inpatient stay. So if you're a hospital CEO, it just makes a hell of a lot more sense to push folks into inpatient admission instead of wasting your time and wasting your money letting them get cheap primary care outside the hospital. Or it makes even more sense to buy up all the cheap primary care clinics and then use them to charge hospital rates. What's the result of that? 1 in 6 Americans have no access at all to any primary care. So as you can see, there are 2 fundamental truths to American healthcare, right? One, if you're a payer, like an insurance company, it's just not profitable to insure people who are sick. 2, if you're a provider like a hospital or an equipment manufacturer, it is extremely profitable to charge sick people as much as possible, as late as possible, so long as somebody's footing the bill. We've built upon these jagged rocks the big loathsome church of American healthcare, in which the question of who gets to receive healthcare and when, or really whose suffering matters, is determined by private profitability. And now this whole situation scares the bejesus out of everybody involved, particularly insurers, right? Insurers are interested in finding ways to avoid paying these rising costs. Often that means refusing to pay for claims. It's probably happened to you or somebody that you love. Before the Affordable Care Act meant insurers would just refuse to cover people who were likely to be expensive. You might know the phrase pre-existing conditions. But it's still not enough to claw these costs down. So we all got together, everybody in America, back in the 1970s when we all were alive, and invented the idea of consumer-driven healthcare. That just means you should make consumers, which is just a libertarian way of saying people, pay more for the costs of their own healthcare, right? Because that's what they call them, man. But this is why your premiums, your deductibles, and your copays go up every year, right? Because you have to pay more for your own health care, you are transformed into a smart shopper somehow. And through the power of the free market or whatever, you shop around, you don't get expensive or unnecessary care, you find the cheapest ER in town if you get hit by a car, you Yelp your surgeon, and somehow, through all this, we bring prices down. No, that's obviously horseshit, right? We just internalized the language of the oppressor. Because insurance companies can't afford the rising costs of healthcare, their brilliant solution is to force more and more of those costs onto us. Right now, the average high-deductible healthcare plan has a deductible of $2,700. 40% of Americans have less than $400 in their savings account. And you know what's even worse than that? The shit doesn't even work. No, people who are forced to pay for healthcare costs they can't afford just don't seek healthcare. Not because they're smart shopping, they don't seek any care at all. Even when that care is free, they don't seek preventive care or primary care. They ignore that rash, they think away that chest pain. Because we demand people bear the burden of costs they can't afford, they just gotta watch their bodies turn to time bombs until they have a heart attack at their jobs and leave their kids behind. So what do you do? Right? How do you square the rampant increase of healthcare costs with the fact that it's just not profitable to insure sick people? Well, if you're the Democrats, you can collaborate with the Heritage Foundation and offer us the Affordable Care Act, which is, at its core, the massive subsidization of private industry with public money. The ACA is a big bargain, right? A big plaintive wail, please, 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 that asks, how many hundreds of billions of dollars do we gotta give you so you stop getting sick people off their insurance plans? Well, the ACA, of course, had its successes. First and foremost among them, the expansion of Medicaid. When Medicaid was expanded, we saw a 6.1% reduction in the mortality rate. That's 11.1% among communities of color. And we understand why, right? These are folks that have been systematically and often violently denied access to health care in the first place. So even the relatively meager expansion of Medicaid does a hell of a lot to help folks get essential care when they need it. But it's not enough. Because at the end of the day, costs keep increasing. Quality of care stagnates or worsens for the most vulnerable among us, and 31 million people are still uninsured. Like it or not, the ACA has failed in its pursuit of health justice. No, because there are consequences for this failure. Right? There are grave consequences for this failure, because among so-called developed countries, it is America that is the most dangerous place to be sick. Among peer countries, America is the most dangerous place to be black. Black infants die at twice the rate of white infants. America is the most dangerous place to be pregnant, with the highest maternal mortality rate of any first world country, of which 60% are clinically preventable by taking somebody's blood pressure. America is the most dangerous place to be a child, the most dangerous place to be a woman, the most dangerous place to be gay, the most dangerous place to be old, and one of the most dangerous places to be disabled. Last year, life expectancy at birth fell for the first time in almost 30 years by 1/10 of a year. And there were 4 million people born last year, and that's a theft of 400,000 years. But a funny thing happens when you look at the data more closely. And you know precisely what I'm going to say. It is woven in the American fabric. You understand that when you look at this data more closely, all this danger only exists if you're poor. Because rich people get to be exempted from all these problems. Men born in the wealthiest fifth of Americans get to live 15 years longer than men born in the poorest fifth. Among women, that gap is 10 years. America has made a choice, and it has refused to recognize the essential dignity of being human. And in this refusal, it has caused mass suffering. No question about it. This is an act of war. This is the terrible secret of American healthcare. This is the fundamental American illness. They are quite literally killing us and robbing our corpses to foot the bill. And now this big, stupid, multi-payer, profit-driven Rube Goldberg machine of American healthcare is failing us today, and left unchecked, it will collapse tomorrow. That is incontrovertible. It will collapse. So enough. We demand something different. We demand a federal, universal, single payer. That's right. Single payer, I'll make it quick. Single payer is a pretty simple concept, right? It's not that difficult. Instead of having a bunch of private insurers with a bunch of little fragmented customer bases, each seeking to avoid taking care of unprofitable sick people and passing that potato down the road, we have one publicly owned, publicly funded insurer, a single payer, with a legislated mandate to cover in full all care for all people. And now that phrase, like Luke brought up, all care for all people, is important. We don't want Medicare as it exists today. It has been hollowed out for private profit. There's cost sharing, there's out-of-pocket expenses, there's private profit within those markets. No, we want an improved Medicare that guarantees comprehensive coverage, medical, dental, vision, long-term care for all people in America, including non-citizens, that is free at the point of service with no cost sharing. Right? No longer will somebody needing help be bound by Byzantine provider networks designed to confuse and frustrate you. No longer must you choose between food and medicine. No longer will your care be dictated by who your employer is or who your insurer is, because your insurer is Medicare. Everybody benefits when accessing care is free and easy. Right? Delivering care, being a nurse, being a doctor, being a social worker, that's complicated. Bodies are big bags of unknowable goo and they hurt all the time. Making them hurt less is a complicated process. Paying for it isn't. Paying for it's pretty simple, right? People ask, how can we pay for this? Well, we're already paying for it. We're just forced to spend that money really, really stupidly, right? Right now, American public money pays for 2/3 of all healthcare costs in the US. A little less than half of that 2/3 is direct Medicare, Medicaid, or VA spending. Other half of that 2/3 is just government subsidies to private companies. You are quite literally paying taxes to subsidize your own employer. The remaining third is out-of-pocket costs. An additional kind of private tax you pay to hospitals and insurers in the form of premiums, deductibles, and co-pays. You see, America is already spending the money required to fund single payer. It's just that the insurance industry is really bad at its job. It's incompetent and unable to pay its fair share. So it passes the costs back to you. And that's one hell of a scam. Right? We know, and we have known for decades, that rising costs come from rising prices, not improper hospital use or whatever. But since that doesn't help the insurance company make a profit, they just ignore it and stick us with the bill. And then they hold our mediocre insurance plans hostage to the government in return for subsidy. It's all a giant fraud perpetrated on the American people. We already know how to use a single payer to halt rising prices, price negotiation, with the weight of 300 million people behind it. Asked and answered. And what's more than that, we know that once we cut out the administrative costs, profit-seeking, and advertising within the private insurance market, we free up, in a very conservative estimate, an additional $370 billion a year, which is a pretty big chunk of change. So what do you do with it? You use it to improve everybody's standard of living. You build primary care clinics in rural areas, or more accurately, reopen the ones that have closed. You fund community health centers in poor neighborhoods, and most importantly, you return the money to the people who do the work. Take, for example, y'all know home health aides? Ever have a sick friend, sick parent, sick kid? A person can receive care at home, $2,000 a day, but oftentimes a person can receive care in their own home. For a lot of people, not everybody, for a lot of people, home is a nicer, better place to be, right? Home's where the internet lives, home is where your dog lives, home is where your friends live, right? A person can receive care in their own home for only $120 per visit, right? So everybody benefits. Cheaper care, more humane, we all win. We all win, of course, except for the home health aides themselves. Because for this essential labor, they are paid a nationwide average of only $11 an hour. So we can use this money to do what the private market has refused to do, which is pay fair wages for the 1.2 million home health aides and all the other essential laborers who help everyone. Let me give you another example. I visited a hospital in Little Rock, Arkansas, right? Little Rock's one of the diabetes capitals of the US. And you leave diabetes alone too long enough, and it turns into things like cardiac failure, heart attacks. And people from all around the county come to this hospital and seek treatment for cardiac failure or heart attacks, but over a quarter of them come back to the hospital within a couple of weeks. Obviously, that's not good, right? And so this hospital, which was getting penalized by Medicare for its high readmission rate, wanted to try to bring those rates down. Now, what do you think they did? Right? Well, they just hired social workers, and they hired nurses. And they took patients in after heart surgery and gave them Medicare-sponsored social exercise and cooking classes in a big group environment 3 times a week. And their readmission rate fell from 26% to 4%. Think about it, right? Who makes a real difference in health outcomes? Is it the millionaire CEOs? Is it the expensive luxury, like hotel-like suites and the expensive luxury hospital wards? Is it the $40,000 data packages for nerds? No, of course not. They just get to bill the most. The people who make a difference are people that do non-diagnostic extra-clinical care. It is compassionate labor that really makes all the difference. It's social workers, patient advocates, and nurses. These are the folks who are both chronically unrecognized and underpaid, and they're also the primary people who make a difference in population health. These are pretty basic ideas, right? These are all pretty simple demands. We understand that, yeah, hell yeah. We all understand pretty intuitively the social forces that make folks healthy, and we understand the structural ones that make them sick, right? But in the face of this knowledge, that population health is a structural and social problem, knowledge we've had for literally decades, if not longer, capitalism's response is to blame illness on an aggregate of individual choices and then package them into healthy lifestyle commodities, right? On apps and cookbooks and step trackers. But despite what app companies insist, there are no apps that bring about better health. A How to Survive on $4 a Meal cookbook doesn't do shit, and is in fact pretty offensive for folks who only have $4, if that, per meal. An insurance program that penalizes you for going to the ED at the wrong time doesn't do anything to make you healthier outside the hospital. But in the multi-payer private model, nobody's investing in population health. Nobody's investing in compassionate labor. Nobody is paying these people fairly, and they never will. Because right now, your private insurer only bears the cost of you receiving care while they're insuring you. Because you're going to change insurers in the future, and God permitting, one day go on Medicare, they feel no pressure to provide you with care that keeps you healthy or makes you healthier in the future. Let me put it another way, right? You know that if you're at home and your window breaks, the weather gets in. Especially around now, if the weather gets in, you might get sick. And if you get sick, or if your kid gets sick, you got to go to the doctor. And if the local clinic was shut down or it's booked solid, you got to go to the hospital. And if the hospital's far away or you don't have a car, you got to take the bus. And a lot of places in the US, if you got to take the bus, you got to spend all fucking day dealing with the bus system. If you got to spend all day dealing with the bus, you can't go to work. And if you can't go to work, you can't afford to fix the window that caused the problem in the first place. And so the answer isn't to fork over a pile of cash every time you go to the hospital. The answer begins with giving people what they need to fix the goddamn window. But there are no private actors in the American model who will bear responsibility for these problems on their own, right? Aetna is incapable of addressing the foundational problems of healthcare, of fixing the broken windows, right? Anthem is incapable of reopening the 18 rural hospitals that have closed in Texas in the past 3 years because of lack of Medicaid funds, right? Humana is incapable of repairing the PVC septic systems that are ruptured in rural South Carolina and brought hookworm back to the state, and they're all incapable of fixing these problems in the exact same way that a cop is incapable of shrinking the prison industrial complex. Or a billionaire, even a benevolent billionaire, is incapable of lessening income inequality. They cannot fix this injustice because they've been constructed by and within that injustice. They cannot solve these problems because existentially they cannot conceive of them as problems in the first place. But we can, and we do. And so it makes perfect sense that the same actor who suffers when people don't get care, which is all of us united against suffering, should be the actor who pays for that care in the first place. Because once the federal actor is forced to bear the costs of providing care and the risks and costs of what happens when care is not provided, once we force it to confront the rampant suffering of all its people, it can finally be used as a tool for realizing health justice. If your people are suffering because they don't have a place to live and you get sicker from exposure way faster than disease, or where they live is unsafe, then housing is health care. And you must build free social housing to bring health care costs down. If people are suffering because they don't have access to healthy food to eat, it's not profitable to provide a poor person with vegetables, and so they're getting diabetes or comorbidities like cardiac failure, then food is health care. And you must provide people with affordable or free food options and the time, space, and materials with which to prepare them. That's how you bring health care costs down. And if your people are suffering because they don't have access to needle exchange programs, therapy, or counseling, then rehabilitation is health care. And not our current end-of-life palliative care focused model, but the full social and safety structures required to help people handle addiction or perhaps not fall prey to it in the first place. That is how you bring health care costs down. Because single payer, God bless it, single payer is not the goal. Single payer is an inadequate goal. Single payer is a tool. Health justice is the goal. And when we fight for health justice, we all fight side by side because economic justice is health justice. Environmental justice is health justice. Reproductive justice for those who don't want to reproduce and those who do. That is health justice. And justice for black lives, justice for brown lives, justice for trans lives, justice for the lives of immigrants, justice for people in prison, and the well-being of all people, regardless of age, gender, race, or creed. That is health justice. We have been forced to inherit a world in which your permission to receive health care, capitalism's allowance, you can be safe in your own goddamn body, is dependent upon how much somebody can extract a profit from you. And thus we have permitted in our country utter desolation. Without our consent, we have been forced to participate in the condemnation, criminalization, and abandonment of people in need. People with disabilities got to spend tens of hours a week pleading with their insurance companies for a chance to maybe go on a waiting list to receive the basic care they need to stay alive, if they're lucky. The unlucky ones got to spend tens of hours a week pleading with Medicaid or Social Security to maybe consider compensating their partners, friends, or parents a whopping $1,000 a month for taking care of them full time. Elsewhere, across the U.S., at Burns, we have the opioid epidemic. Right, an epidemic whose vector is capitalism itself, which was originally manufactured as a patent extension ploy with a massive advertising campaign and now kills 180 people a day. But those it doesn't kill are written off as criminals, right? Because only criminals use needle drugs. Who cares about them? They're thrown to the side, left to rot, while their children cry their names. People who suffer from chronic pain are pushed to the side, stigmatized, ignored. In life, it is poor and uninsured people who are used to test the drugs that are then sold to the wealthy and insured. And this servitude continues in death because it is primarily the organs of the poor that are ripped and sold to the wealthy as transplants. There is no end to the body horror of capitalism. There is no line too far for the commodification of the body. America has cheered the privatized slashing and burning of social structures and then has the audacity to punish people for suffering. When people are in need, we waste time, effort, and money means testing them, separating the so-called worthy from the so-called unworthy among those who need help and then stigmatizing them instead of guaranteeing the basic decency of equity. And for systematically marginalized people, sick people, homeless people, people battling addiction, people with disabilities, poor people, pregnant people, trans people, women, and people of color, well, when there's no way for anybody in the medical industrial complex to make profit off their bodies, this is America. And there is the private prison system ready to receive them for profit. And so, my friends, healthcare is not enough. Our fight is for something much greater than just insurance. We have been made sick by structural poverty and structural racism. We have been bitten by the wicked snakes of racial and economic and patriarchal domination. And these are not problems that insurance alone can solve. And so when we attack, we must aim for the heart, the beating heart of capitalism and capitalist exploitation. And so single payer is not the revolution. It is our first counterattack in a war that is already waged against us, by which subsequent counterattacks are made possible. Hell yeah. Let's think real careful about our history, right? For the past 100 years, every time the insiders, the well-meaning Democrats, right? Even the well-meaning senators and representatives, the well-meaning policy writers, the well-meaning union or nonprofit leaders, every single time these well-meaning folks have taken on the insurance industry, they've been beaten by a reactionary establishment capable of outfunding, outmaneuvering, outfoxing, and outgunning health reform, right? The insiders lost in the 40s. The insiders lost in the 60s. They lost in the 70s. They lost 3 times in the 90s, and they lost in the 2000s. But when these folks lose, it is not the senators or the union leaders or the policy nerds who find their suffering compounded, right? They're not the ones that go home hungry and broke. It's the people who live in Section 8 housing. It's the people in prison. It's the people whose backyards are dumping grounds for toxic waste. It is the people with disabilities who are forced out of their homes. It is the poor mothers and their poor children. It is the people who have been denied work, care, or dignity who suffer when the insiders lose. And so we have an obligation. We must not lose again. We will not lose again. We stand on the shoulders of hundreds of thousands of nurses, of tens of thousands of doctors, and realistically, in the bright legacy of grassroots movements like ADAPT and ACT UP, the most powerful popular medical movements in the past 30 years. And we must, in their shadow, build the massive popular movement which not only demands a single payer from our state, but which demands health justice in our nation. We must bring to the front our neighbors and friends who have been immiserated, who have been made to suffer most cruelly. And we must demand the crowns of thorns that are thrust down upon their heads are lifted. And we cannot rest until they are liberated and the suffering inflicted upon them is released. We must take our little lights, right, and build the massive, searing flame which burns to a crisp anybody who dares stand in the way. But there's good news, right? We know what to do. We know what works. We have an obligation to ourselves and to those that we love, now and in the future, to be good neighbors, right, to be good socialists. We must extend the basic decency of showing up, of going to folks around us, asking questions, listening, finding common ground, listening, and then putting our shoulders to the wheel. We must identify what battles we can win, and then we got to win them. We must provide material relief to people around us who are suffering now. We must fight in our homes for a continuous spectrum of demands aimed toward health justice. And unlike liberal policy tweak incrementalism, which is boring and unambitious, our successes must be material and redistributive reforms. And the ways people are taking on this fight across the U.S. right now are many, right? California, San Francisco, DSA fought for one Proposition F, guaranteed public funding for representation if you're evicted from your home. A little bit further north, Olympia, Tacoma, DSA unionized tenants in the slum and got them material reforms when their homes were being bulldozed. In Cincinnati, 8 people won a needle exchange. 8 people won the first needle exchange in the two-county region, them in northern Kentucky. Back home in the progressive bastion of Texas, we've got the paid sick leave movement, right? Paid sick leave in San Antonio, which affects 70% of low-income workers in the city, turned out 144,000 signatures. Now, for comparison, 99,000 people voted for mayor in the last election. This is the largest popular movement in years, if not decades, in that city. Up now in Idaho, there's a gal and her husband bought a camper van, painted it green, and drove around the state for Medicaid reform. They got 80,000 signatures in a few months, and they've been canvassing ever since, and they're going to win this election day. Now, I don't know what the revolution looks like, but I know it's going to require that kind of massive mobilization. What we saw in San Antonio, what we saw in San Francisco, what we're seeing right now in Idaho. Because it turns out, if you just give people things that are material, they'll fight to keep it. Hell, they'll come back and fight for the next thing. If we fight with folks today, they will fight with us tomorrow. We build solidarity not for fun, but as a function of building power. Our job is not to build a popular movement, it is to stitch together a popular movement, a big, messy quilt of movements for health justice spanning the country from coast to coast and plains to Gulf. And through this massive mobilization, and only through this massive mobilization, this is a fight we will win. I mean, hell, the math's in our favor, right? What is it? 70% of people across the U.S. prefer Medicare at all nationwide. This is not a radical proposition among the folks it affects. We're just discussing a basic principle of fairness. And you know that, right? You know it deep down. You know that we're all just fashioned and horned from a formless and shapeless place. We've been thrust through the maw and born into a world that is arbitrary and unequal in its allocation of human suffering. And yet, instead of affording each other the basic dignities of being human, we have developed this bizarre and punitive system of American health, in which one's suffering is one's own responsibility, in which our empathy for those around us is unnecessary, vestigial. We have atomized suffering, and in turn, we have assigned blame for suffering to people who suffer it. And I've seen, I know you've seen, so much naked suffering inflicted in our names. I know that we've seen families ripped apart by the unrepentant, unyielding bloodlust of capitalism. And I know you've seen people torn apart limb from limb in the service of extracting profit. I have seen the dehumanizing machine all at once and felt despair. For me, it is often heinous to be an American, right? To be complicit through my simple existence in my only and horrible home, the home I love so much, who harms so many, in the mass immiseration and annihilation of those against whom the whole rotten weight of the world has been stacked. And this is intolerable to me. And I hope it's intolerable to you. And so we say, enough. Not in our name may this America persist. May we root ourselves not in fear, but in love. And from that love, may we cultivate the specific fury by which this machine will be destroyed at our hands. My friends, single payer is moral. Single payer is necessary. And I swear to you, single payer is achievable. And I'm so proud to say before y'all, with y'all, solidarity now, solidarity forever.